Good day to all of you. I'm Pramod Desanta, representing Research Group 12 of 26th batch. Welcome you all to our research presentation, Knowledge and Attitudes Regarding Physical Activity During Pregnancy Among Pregnant Mothers. Pregnancy is an important period in life of a woman. It is a time of great uncertainty and stress, which is compounded with many physical, psychological, and social changes in a woman. In the absence of medical or obstetric complications, pregnant women are encouraged to continue and maintain active and healthy lifestyle during their pregnancy. However, it is important to have an adequate knowledge to practice antenatal exercises. Exercising during pregnancy has been proven to be safe and have many benefits. Socio-demographic factors such as age, education level, employment state, monthly income, and pregnancy history such as parity, mode of delivery, previous antenatal complications contribute to knowledge and attitudes regarding physical activities during pregnancy. Preconceptional health status of mothers also matters. We were interested about this topic as researches done in Sri Lanka under this topic were few compared to global studies. Our study was carried out with the general objective of describing knowledge and attitudes regarding physical activities during pregnancy among pregnant mothers attending antenatal clinics at MOH Purleskamu and associated factors. Specific objectives were to describe the knowledge, to determine the attitudes, to describe the associated factors for knowledge regarding physical activity during pregnancy. We selected the antenatal clinic at MOH Purleskamu as our study setting. We conducted a descriptive cross-sectional study. We selected pregnant mothers having completed 20 weeks or more of period of amenorrhea who were registered with antenatal clinic at MOH Purleskamu. Pregnant mothers who are mentally unsound to give consent or with visual or hearing loss, impaired memory or cognitive functions, or otherwise unable to respond rationally to a questionnaire was taken as an exclusion criteria. Pregnant mothers who have been medically advised to bed rest and minimize physical activity during pregnancy were also excluded. Sample size of 100 pregnant mothers who met the inclusion criteria was selected for the study. However, due to ongoing COVID-19 pandemic, we reduced our sample size to 75. Sampling was done by systematic sampling technique. We collected the data using interviewer administered questionnaire. Data were collected by conducting telephone conversations to assess the clarity of words, flow of questions, and interpretation of words. Pre-testing was done prior to proper data collection. Data analysis was done by using SPSS software. Chi-square tests were performed to assess significance. P-value of less than 0.05 was taken as significant. Ethical approval was taken from Ethic Review Committee of Regional Director of Health Services, Colombo, and Ethic Review Committee of Sri Jagadhara University. Results of the study are as follows. Mean age among pregnant mothers was 29 years. 57.3% were above 30 years and 52% were unemployed. Majority had heard about antenatal exercises before. Among them, only 20% were practicing regular exercises before pregnancy. 81.3% of who are less than 30 years had good knowledge about physical activities when compared with who are about 30 years of age. Among employed mothers, 62.2% had good knowledge about physical activities. Among unemployed mothers, only 36.8% had a good knowledge. In urban areas, 51.9% had a good knowledge about physical activities when compared with semi-urban areas, which was 77.1%. Among pregnant mothers who had monthly income less than 50,000 rupees, 52.8% had good knowledge, and who had income more than 50,000, 82.1% had good knowledge. Age, employment status, residential area, and monthly income were found to have statistically significant associations with knowledge. Pregnant mothers were shown to be adequately knowledgeable concerning the practices of physical activity during pregnancy, which reflects some improvement of antenatal care seeking among pregnant women. Measures were taken to minimize interviewer bias, selection bias, and information bias. Multiple variables for antenatal exercises were measured, which increases the internal validity of the study. In conclusion, this study reflects that knowledge and attitudes regarding antenatal physical activities among pregnant mothers attending antenatal clinics at MOH Burlesque were good and favorable. This study recommends that pregnant mothers should be educated by public health midwives at the antenatal sessions. Midwives directly contact mothers and they have good idea about one's family history, past surgical or medical history, past obstetric history, and personal information. So they can give appropriate advices about physical exercises and they can acknowledge mothers that exercise can be started from first trimester according to mother's health. Also, we can provide practical sessions and provide a booklet that they can read leisurely and understand the importance of exercise during pregnancy. Finally, we recommend to conduct this study in other emerging areas in Sri Lanka from time to time till satisfactory results occur. The best way to keep your baby healthy is to keep yourself healthy. Thank you. These are our references.